That's another thing that I always talk with patients, because you're not just coming in for that iron infusion, right? You also want to figure out, why are you iron deficient? Why is oral supplementation of iron not working? Why is food sources not adequate? What's draining your iron storages? So you always want to find out the root cause so you can address that at the same time. Or else, if you're bleeding heavily, you might be back in 6 months for another iron infusion if you haven't treated the root cause.
Welcome to Personalized by VitaminLab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Duizer. Please remember that the following discussion is for educational purposes only, and is not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by VitaminLab. I'm your host, Dr. David Duizer, and today's guest is a colleague of mine at Noble Naturopathic and someone whose practice is about as close to full-scope naturopathic medicine as it gets. Dr. Ming Mei Zhang is a naturopathic doctor who doesn't narrow down. She opens up, bringing her entire scope to every patient, every visit. Physical medicine and pain management, hormonal, metabolic, and digestive health, IV therapy with iron and NAD for patients battling fatigue, injection therapies for pain and joint restoration, and aesthetic services like neuromodular injections that connect how patients feel on the inside with how they feel about themselves on the outside. It's rare to find a practitioner who moves this fluidly across the full breadth of naturopathic medicine and does it without compromise. That's what we're going to get into today, and how she thinks about whole person care, what it truly means to practice holistically, and how she decides what each patient actually needs when almost everything is on the table. Please welcome Dr. Ming Mei Zhang. Welcome back to Personalized by VitaminLab. I'm here with Dr. Ming Mei Zhang. How are you doing today, Ming Mei?
I'm doing well. How are you?
I'm doing great, thank you. Thanks so much for joining us. I've been wanting to have you on the show for a while because I work with you and know that your career is really cool, and I'm inspired by all the things you're doing. And I think that it could be helpful for practitioners out there, both naturopaths and functional medicine doctors, to learn from your educational journey, for one, and how you've been able to apply your skills to your patient base. So again, thank you. I really, really appreciate it. Let's jump straight into some questions. The first one is, what really drew you to naturopathic medicine? Like, how did you even get into this field?
Yeah, so as you probably already know, I was working as an RMT prior to becoming an ND, and I was working with some naturopathic doctors in my clinic. And I remember at that point I had gotten into a car accident and I wasn't feeling very well. So I had the, physical injuries. I probably had a concussion. I was tired. My diet was terrible. My sleep was terrible. There were so many things I could have improved. And I think the ND that I was working with at the time was like, okay, well, why don't you let me help you a little bit? And I remember she gave me the option for treatment with Prolotherapy, and that really helped with the injuries that I was experiencing. It took a few treatments. I think it took about 6 injections. And I remember during those injections, I was like, is this working? Is this working? And then after the 6th injection, the pain just went away. And I was ready to live with this pain forever, because I was like, is this ever going to go away? It's been months since the accident, and I was still working through the pain. So that moment when the pain went away, it felt pretty incredible. And then she also, she was watching the things that I was eating while on the days that she was working with me. And she basically looked at me once and she was like, hey, I'm going to save you from diabetes. And I was like, what do you mean? Am I diabetic? I think she was seeing symptoms of insulin resistance at that time, and she was seeing what I was eating, and she was seeing how tired I was, both from, bad lifestyle plus the post-concussion. And she offered some changes, and yeah, it really helped. I remember I was able to get up in the morning at 6 a.m. without an alarm for the first time in my life, and I felt energized and way more clear-minded. And yeah, it made a huge difference. And that was the first time in my life I was like, okay, wow. What I do on my day-to-day basis, my diet, my lifestyle, can have a huge impact on how I feel. And it's funny that I never clued into that prior to that.
Yeah, so many people don't. That's really cool. That's super inspiring. And then, you're already in a career at that point, right? Like you're a massage therapist, you're working, and it's a huge jump to go back to school, especially, 4 years. And so you make the jump, and what's it like? Well, what's the transition like? Are you working during that period of time?
Yeah, so it was definitely a transition. I had to pay tuition somehow, right? And
Hmm.
it's not cheap. So I did have some savings, and then I did work a little bit. I had, great clients that I had already had a, report with, and I kept working usually like a couple hours after school. Yeah, so I did some work, but it was definitely tough because school was busy.
Oh, completely, completely. So then you graduated as a naturopathic doctor, and so I didn't really know you were inspired by prolotherapy and its effect on you. That's really cool. I love that. So did you have a goal like that you'd straight away become trained in prolotherapy?
Yeah, I did actually. So
Yeah.
I thought, because with the background in massage therapy, and I've always been very interested in human anatomy, and from that incident, chronic pain, orthopedic injuries, and things like that. So I always had this goal or thought in my mind that after I graduate, I would get my prolotherapy certification right away, and I would kind of continue down that path.
Cool. So you get started. I assume you go and get trained straight away. But my experience with you is that you didn't stop there. You kept going
No.
for training
Yeah.
after training. Did you think, okay, so once you completed that, and this is a big question for all new grads, and you know, pretty much we've done 50 episodes. Pretty much every single person that I've had on the show has said niche down, pick a lane, treat one patient population, with the exception of maybe one person. So you had this intention of doing prolotherapy, but then you go on and do all these other courses and build this really cool scope of therapies. What inspired you to do that? Were you doing that straight away? Like, what's the timeline? Tell me a little bit about it.
Yeah, I think honestly, even throughout being in naturopathic medicine school and having the opportunity to preceptor with a wide variety of, practitioners, I think that was really inspiring for me. Like I found so many things interesting. And I think I'm like a naturally curious person, and I am interested in a lot of different things, and a lot of different things intrigue me. So when I, preceptored with the different practitioners and I saw what they did, everything was just so interesting to me. And I wanted to try everything. And I think some of the certifications or things that I do, it kind of came just out of, by chance. I learned certain skills. And I'm very thankful for that. Other ones, I think it was just about curiosity. Like I preceptored with people who specialized in, or we can't say specialized, but who was very, physical medicine heavy. I preceptored with people that were internal medicine, women's health, with aesthetics, cosmetic procedures, with physiotherapists who did a lot of needling. So all of that, I think, really drew my interest.
Really cool. So now you've built up this practice where you're using all of these therapies. And I'd love if you could just reflect a little bit on the two pathways. So if you were to speak to yourself now, say you were just graduating, would you give yourself a recommendation, say, for example, to just niche down and do one thing and stick with that? Or would you do it all over again the same way?
To be honest, I feel like even when I was in school, like a lot, and a lot of the people that I did talk to told me that I should niche, even in, the business education that we got. I think part of the recommendation was to, pick a niche, have a, ideal clientele or patient profile in your mind. But I was just never able to do that because I have a wide variety of interests and I'm
Sure.
intrigued by many different things. And I think that's actually part of, I remember going into naturopathic medicine school, like the interview, they asked me what's another thing that drew me to naturopathic medicine. And it was because we can keep learning. Like
The huge scope.
our scope is wide and we're really holistic. Like there's so many different avenues that we could go down. And that aspect of it and, that drives a person to keep learning different things is also something that brought me into naturopathic medicine and keeps me here.
I love it. I love it. I think it brings a lot of people in. And honestly, I think they lose it. I think they lose it because the financial aspect of it, and even taking extra courses is so expensive.
Yeah.
And then the burden of how hard it is, right? Like it's actually quite difficult to do these courses and take your weekends and study hard and do all the things.
Totally.
And then you get into clinical practice and it's like people have all these different challenges. You have good tools, but it's hard to be the highest level of expertise in every single clinical tool. Yet here we are years later, and I look at your schedule and it's a massage, registered massage therapist, it's IV NAD, it's IV iron, it's trigger point therapy and prolotherapy all in the same day in our clinic. And that's just incredible. And for me, I've been doing this for 10 years. It's inspiring for me because I can get in my own lane and just do my one thing all day long. But for people who are just graduating and just becoming a naturopath, this is the way, right? To quote The Mandalorian, this is the way, right? You have this huge scope. People need our support, and there's a bunch of clinical tools that you can use to help them. And you've shown that. It's so cool.
Yeah, I think different people obviously practice in different ways, and some people do niche, and I think it's great for them. I think it's just for my personality and my brain and how it works.
Yeah.
I just couldn't do the niching thing. Like I love working with a wide variety of people and conditions, and yeah.
VitaminLab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and VitaminLab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
For sure. So do you have, I don't really know the answer to this question. Do you have like a continuing education, can you like goal list of like boxes that you are checking every 6 to 12 months?
I don't, but I do, want to keep on top of things, and I am very interest driven. And part of it is also sometimes my patients will bring up different things, and it kind of pushes me to go learn certain things or to go down certain rabbit holes. And yeah. But I do still love being able to preceptor. Even at this point, like if I can get into an opportunity to preceptor someone that's great at what they do, I still try. And I really value those opportunities to learn and to progress. Yeah.
Oh, it's a cool approach. I mean, not everybody does that. I have never done any of that, and I probably should have to a certain extent, right? Like I haven't done any of that. But it's really cool that you do. And so you've developed all these different skills and you use them literally every single day. And one of the things that I see that you use a lot, including today, is IV NAD and intramuscular and subcutaneous NAD+. I'm really curious to talk to you about this because I've just been recently trained and now I'm like really excited about this therapy. Can we dig into this therapy a little bit and kind of highlight where it could be used, how you use it, and your approach to the utilization of NAD+?
Yeah, I mean, I think even a lot of patients are very well researched and, they've heard about NAD these days. Like it's definitely been trending for a while. And I think for me, when a person walks in and, given they are a candidate for it and there's no contraindications, if their main concern is brain fog, burnout, low energy, lack of resilience, decreased capacity to exercise, sometimes, if there's an inflammatory picture, sometimes if there's a, post-viral infection picture, post-concussion picture, there's just so many different, things that would kind of trigger me to think about it. Yeah, so in those cases, I would definitely consider NAD as one of the options. I never say NAD is the one and only thing that we do. I do think being in naturopathic medicine, there's many, many tools, but it's definitely one of the things that can be beneficial and helpful in those things that I talked about. Mm-hmm.
Totally. It's a really good way of putting it. It's a tool for these different scenarios. And one of the things you mentioned is the burnout and the energy component. One thing I've found is that like when someone gets burnt out or if they get really, really low on energy, then all of a sudden the deconditioning kind of catches up pretty quick, right? Like if you don't train for a few weeks, you don't do the cardio, you don't lift, start to lose muscle, the mitochondria start to dial down their activity. And NAD can turn the lights on a little bit and get you back out there. And it's crazy, because we say to progressively increase your exercise, but it's really difficult when you're stuck in bed to do any.
Absolutely.
And NAD can be a really good therapy to help people get out.
Yeah, just a little kickstart, a little fuel to the engine.
So was it part of like your IV course? Like how did you get trained in NAD?
Well, I worked in an IV clinic for a while.
That's right.
Yeah, and also I did take their IV course when they first started, and it was very informative. Yeah, it was mostly through that.
How do you know when it's working? What are you tracking? Like, so obviously people get better energy, but what's kind of the long-term outlook of this therapy?
Yeah, so generally, like better energy is definitely one of the things that we notice, and better sustained energy. It could be better resilience to stress. It could be better capacity to exercise or better muscle recovery that people have noted. It's funny because a couple of days ago, I had a patient tell me like, oh, last year I was doing all these IVs and like I didn't get sick, like, and I felt great. And then he kind of fell off of it. But yeah, it's just long term, that seems to be the things that I hear the most commonly.
Yeah, makes sense. How do you choose the dose? There's too many doses. This is so complicated. Like I look at the dosing, even what we offer here. I mean, we've got like 6 different doses. How do you develop a dosing schedule for someone?
Yeah, absolutely. I think NAD, when we drip it, the sensations are a little bit different than, the other IVs that we offer, right? So I think it really is dependent on the patient. It depends on their history, how's their blood pressure, how's their liver and kidney function. Do they have a history of anxiety? All those things kind of play a role. And then it kind of also depends on what their goal is. Like, is it for burnout? Is it for mood? Is it for, brain fog? Things like that. Yeah. So it really depends on the person.
Can we pick a path then? Let's pick a path. What's your most common path that you're using it for? Is it brain fog or burnout? What is it like?
Yeah, probably burnout.
Okay, let's talk burnout. So burnout in Vancouver is insanely common. Like people are working too hard, 60-hour weeks, and people are just absolutely crushed trying to keep up with this city. It's quite unbearable sometimes. And so let's say someone came in and that's been their experience, 5 years of 60-hour weeks, and just absolutely total wrecked. Tell me about the dosing and the sort of frequency of usage that you would use.
Yeah. There's definitely different protocols out there, but for, realistically patient schedule and also, my schedule, we've kind of usually what I do is they come in for their first visit. If they are a candidate, everything's good. Then I might I might offer a lower dose to start just to make sure they tolerate it well, because not everybody tolerates NAD, right? And it also depends on if it's a male or female patient. So I might start with say 100 milligrams and see how they do with that. And it depends on the response. And then, I might dial it up a little bit more the next session in a week or in 2 weeks, depending on their patient schedule. We always have an ideal protocol, but it also depends on the patient and their schedule, because we don't want, scheduling this thing in to be an extra stressor for them, especially if they're burnt out already. Yeah, but they usually come back within a shorter amount of time to kind of boost up the levels.
Let's say you start at 100 milligrams and they have a completely open schedule and feel miserable and really need the support. What would be the ideal protocol for someone like that? I'm working with 3 people right now, 3 females right now, who are literally going through this exact thing. And I'm using the course that I just recently took to build a schedule for them. But I'm much more interested in your course, if you had kind of all the capacity to give them what you think would be best for them.
Honestly, if they had an open schedule, they should, and somehow it matches with my schedule, they could benefit from probably coming every day.
Every day. So you think more is better?
Yeah, more is better in the beginning.
So 3 days in a row.
Yeah, 3 days in a row, or even 5 days in a row, or if they can come back within a week, because it's time, but it's also financially a commitment.
Yeah, completely. Okay, so loading up the body, sort of like that front load that we do with creatine, for example. Okay, that makes sense. Understood.
Yeah.
And then what have you noticed on the flip side of this? Maybe someone who it really hasn't worked for, or maybe they've had negative reactions to it. What kind of things come up?
Yeah, absolutely. So there's definitely been different things. Like some people just don't tolerate NAD or they don't enjoy the sensations. I think most commonly that's the one. Either it triggers their anxiety and they just cannot handle the sensation at all, or some people get that congestion that they really don't appreciate, or it just they haven't they I've had somebody get very exhausted
Oh,
after
really?
the NAD IV. Yes.
No way.
And all, yeah, that's actually can happen. It can happen. And usually that type of person, either there's other deficiencies happening where that we haven't found, or it was not the right dose
Yeah.
or the right speed.
Can I interrupt you there for just a moment? Because it's inspiring to me because I was actually thinking about this morning. Are there a group of like substrates, like vitamins, minerals that we're supposed to be giving with NAD?
It depends on the person, but I feel like if you think about NAD and its physiology in our body, it drives cellular metabolism in the mitochondria, and it needs basically all the other cofactors that are needed to drive that as well. So if you think about our, electric transport chain and things like that, all the nutrients that are needed there, those are necessary, right?
Would you like every time make sure that they have been supplied with those nutrients, or just depending on the person?
Depending on the person, and I know different practitioners have different ideas on that. So I won't really, push my own ideology there. But yeah, if you look at the physiology, I think it'll make a lot more sense, like the different nutrients that are needed.
For sure. Okay. So it's an excellent therapy, and you've inspired me to do it, and I'm really excited about it. So thank you so much, and for giving me a little bit of your approach there. In an ideal world, more is better in the first couple weeks. I love that. That's the best.
Yeah.
That's the best. Let's transition to another one that's really popular in your practice, and that's intravenous iron. In fact, it's really taken off across the city of Vancouver because it can be so impactful for people. And I have been on the fence about it for so long because I just worry so much about the side effects. But what you've taught me is that it is quite well tolerated, really. And a lot of the things that, people fear about it are sort of from an older type, right? An older prescription iron. Tell me a little bit about the side effect management of IV iron and what you think about the safety profile.
Yeah, I mean, it definitely does have certain side effects that can happen, more so than, the regular nutrient IVs that we do. So I usually do screen patients. And then, if they are at a higher risk of a adverse reaction, I actually do convince them to or advise them to go to the hospital setting, just because, a hospital setting is a lot more equipped, despite that our clinic being very well equipped with the medications and what's needed to triage some of those situations. But it's still better to be in a hospital setting for those patients, right?
Who are those patients? What is the setting where you would refer for this?
Yeah. So if a patient had, say, last time they had an iron infusion, they already had a reaction.
Yeah.
So if that's the case,
That's a good one.
you should probably, be in the hospital setting for that. Or, if, say, for example, they have a history of being allergic to many different types of things. So their immune system is already very active, very sensitive.
Okay, so high allergic potential.
Yes, I would probably refer them out to a hospital setting. Certain autoimmune conditions, that could be where the immune system is a little bit more, again, flared up again, high inflammatory potential. I would probably refer them out.
Okay, fair.
Yeah.
Fair. So how do we make this decision? So let's say, we have a person who has had low iron. What is the lab work that you start with? Like, what does the pre-screen actually look like?
Yeah, so usually I would require a complete blood count to see their, hemoglobin levels, red blood cell levels, and all that's included in there, and their ferritin, which is their storage iron levels. And then for certain patients, that iron study might be required.
Okay. And after that comes back, so that only takes a couple days. What is the dosing strategy? How do you decide on the dosing for the individual?
Yeah, so it actually does depend on that lab work. And of course, during the pre-iron consult, we also go through, past medical history to make sure that the iron infusion is safe for them.
Right. What's the kind of analysis required there? Like, how does it work? So, for example, if there's a ferritin at a certain level that confers a certain dose, and what are the levels and the doses?
I mean, you can customize it to whichever the patient's deficit is, right? But it's dependent on their ferritin and their hemoglobin, how much the patient weighs. It's calculated based on that, and the dosages, you can order different dosages from the pharmacy. There's actually no set dose.
Okay.
Yeah, so it is customizable.
Yeah. So is there like a calculator that you use and you plug in the info that you get from the labs and that kind of spits out the dosing?
Yes, that's right.
Oh, very cool. Very cool.
Yeah.
And then how long do those IVs take? Are they long ones?
It depends on the dose again, because it is a controlled speed. It usually varies between anywhere from 2 hours to like 3 hours. Yeah.
And then what's the expectation following for patients, like for people watching? I guess for clinicians watching as well. What can a patient expect in the following days and weeks?
Yeah. The most common thing after the iron infusion is a minor subset of population might feel some flu-like symptoms or fatigue, but most people feel great or feel nothing at all. And for the next 6 to 8 weeks, the iron is kind of settling at a new norm in their body. So I always tell people to wait until at least 6 to 8 weeks before they retest their lab values again, if they wanted to find out where their iron's settled.
So 6 to 8 weeks. And I guess it probably depends on the person if it's going to stay there for a certain period of time. Is that true?
Yes, I have found that it really does vary.
What can we expect there? Like, so say, for example, someone has heavier cycles, for example, would they then, be needing another IV in 6 months? Like, what's the typical?
Yeah, so that's another thing that I always talk with patients, because you're not just coming in for that iron infusion, right? You also want to figure out, why are you iron deficient? Why is oral supplementation of iron not working? Why is food sources not adequate? What's draining your iron storages? So you always want to find out the root cause so you can address that at the same time, or else, and if you're bleeding heavily, you might be back in 6 months for another iron infusion if you haven't treated the root cause.
Right. Okay, makes sense. What are some of the side effects that patients can expect? Does it cause headaches? What is it like?
You mean during the infusion or after?
During and within the few days after.
Yeah, so during the infusion, the most common thing might be a little bit of dizziness, because I do find that blood pressure can drop a little bit during the infusion, but not everybody experiences that. Majority of people feel totally fine and comfortable throughout the entire infusion. Some people might get like a really rare reaction called a fish vein reaction, where they get like facial flushing, chest tightness. It almost mimics an allergic reaction, but it's not a true allergic reaction, but it can be a little bit scary for some people. But it's very, very rare and, less likely to occur than to occur. After the infusion, the most common thing might be a little bit of fatigue, but again, most people feel absolutely nothing at all. Some people report feeling great. Some flu-like symptoms can be normal.
Pretty easy. Okay, nice.
There is always a risk of a delayed hypersensitivity reaction with iron infusions, but the chances of that significantly declines 30 minutes after the infusion, which is another reason why I ask patients to stay in clinic for 30 minutes after the infusion is done.
Just hang around. Okay. When I first graduated, it was just becoming part of our scope to do intramuscular iron and then IV iron after that. And the biggest concern for people was the risk of iron tattooing.
Yes.
And I've seen pictures of the IVs causing this, and I've seen pictures of the intramuscular injections causing this. Can you comment on that a little bit? Like, how risky is it?
It's honestly, if you get a good vein, it's not going to happen. So just don't put iron unless you're sure you're in a good vein. That's
it.
Yeah.
Just make sure you're in a good vein.
Yeah, because the only reason why it would happen is if it infiltrated outside of the blood vessel, right?
So if you have people who have really challenging veins, I could see that being a little bit nerve-wracking from a practitioner standpoint. But as long as you make sure that you're in, you'll be fine.
Yes.
Excellent. Okay.
Yeah.
Good to know. Thank you for reviewing that. I know it's like a therapy that not everybody does, but a lot of people are very interested in that, and it's especially transformational for patients. And I think for the functional medicine community, the integrative medicine community who's looking to provide full holistic scope, I mean, this is an amazing thing to add to your practice. It's awesome because it makes people feel so good.
Yeah, it can help. Yeah.
I really can. Now let's transition to like the completely other end of the spectrum, which is pain management, and the fact that
Yeah.
you have like these really cool skills in this thing you're super passionate about is prolotherapy. I've been looking into prolotherapy a lot, and I've referred some people for it, but it's just never been a big part of my knowledge base, expertise, and I'm looking to learn a little bit more about it for you. Like when I've studied it, and when I was just becoming a new naturopath, we just talked about the person who was sort of mentoring me was sort of like it's just like scarring up tissue and making the tissue really, really stiff. And it's like, okay, well that doesn't sound ideal, but obviously there's a lot more to it than that. Obviously, it can be so transformational for people just like yourself. And I'd love to know about, kind of like what your experience has been like using this therapy. And I know that it's sort of, there's lots of conventional physicians doing it. There's tons of naturopaths doing it. The demand is pretty high. What have you noticed about this therapy now that you actually use it for other people?
It's funny because I don't know if the demand is high.
Okay.
I think there's still a lot of people that don't know about it. Like I've had patients come in and I tell them about it and they're like, how come I've never heard about this before? But I will say, yeah, there are definitely a lot more people offering it now, both medical doctors, naturopathic doctors. So it's great. It's offering a lot more options for patients out there.
How do you frame it? How do you frame it for someone who doesn't know about it? Like, what's your elevator pitch for prolotherapy? Like, what actually is it?
Yeah, so I just tell them it's a regenerative joint or regenerative injection. It's meant to cause a local controlled inflammatory response, which, if you think about it, brings more circulation to the area, which also brings in healing factors. So it's great in certain types of individuals, especially if there is hypermobility going on. It works great. Yeah, and I use it for a wide variety of different conditions, whether it's like tendonitis, ligament sprains, arthritis, and things like that.
So it can go into ligaments or into tendons.
It can go into ligaments, joint capsules, tendons. Yeah.
Oh wow! Oh, straight into joint capsules as well. And so why would you put it into a joint capsule? What's the reason there? Just to try to speed healing?
For arthritis.
Straight in for arthritis. Wow, incredible.
Definitely not severe arthritis because at that point, if the cartilage is mostly gone, then there's nothing much to regenerate. But it can be helpful for, say, mild to moderate arthritis.
Yeah, right. How do you make these decisions? So now you've got all these tools. You've got trigger point therapy, you've got prolotherapy, and I know in one of your clinics there's a shockwave available, and we have cold laser therapy. How do you decide on which therapy to use for the person in front of you? Like, what does it actually depend on?
Yeah. Honestly, I like to use a more holistic approach. Oftentimes, say a person comes in with the shoulder injury. I'm probably doing both prolotherapy, and if there's extra fluid left over, I'm putting it in his trigger points. So it's not a single thing. I might also do some needling with, acupuncture needles to release certain muscles. Because if you think about it, if there's a pain or dysfunction at a certain area, I feel like multiple things are affected. It might not just be the ligament. It might not just be the tendon. It might not just be the muscle itself. It's a combination of everything. So I do try to do more than one thing.
Right.
Yeah.
So the prolotherapy would go into the trigger point. So it's the same solution?
Sometimes I change up the solution as well. It depends on the case.
So, okay, I didn't know that. Yeah, I'm completely unfamiliar. What is a protocol? I know you said that your protocol was you started to get benefit after 6 treatments. Is that quite typical? Like, is there usually that many treatments?
So it really depends on the person, and it depends on the severity of the injury. It depends on how chronic it is. It depends on how many things are going on. So I always quote people 3 to 6 sessions to start to see if we can gauge usually around then whether there's benefit or not. And if there is benefit, great. If not, then we should just stop. If it's not working, then it's not working.
Yeah, for sure. And what's the space between sessions? Is it like weekly or what's it like?
No. So for trigger points, I usually recommend weekly. I find that's a good amount of time to come back. But Prolo, at least 2 weeks in between.
You take 2 weeks, so you take a break. Let the body recover and see what it's like.
Exactly.
Okay.
Let it heal.
Right. Okay. And what are the outcomes that we're looking for here? Is it mobility enhancement? Is it pain reduction? I mean, what are you looking for?
Yeah, so pain reduction, mobility, ADLs or like activities of daily living that were previously affected. Say if it's a shoulder issue, it becomes easier to put on a jacket or comb their hair, or better to less pain sleeping on that shoulder. With knee issues, it could be things like being able to walk properly without pain, walk a certain amount of steps without pain. It could be being able to run again. Depends on the patient. And I do get them to track pain after getting the injection so that we can gauge how their body reacted and if there was benefit.
Now, you're also trained in aesthetic Botox. It's like, so far we've covered chronic fatigue, we've covered pain, and now we move into aesthetics. Like, what inspired you just to jump into the world of aesthetics?
Yeah, so it's funny. So my parents were actually in the spa industry. So they were always, very interested in, aesthetics. And they've always been like, you should try it. You should try it. It's a great industry. And I did have a couple of patients ask me about it. And, I did preceptor with a practitioner or a naturopathic doctor who was practicing aesthetics. And I thought, hey, why not? It's interesting.
For sure.
Yeah. I think it can be one more tool.
Have you enjoyed it? Like, do you like practicing? Do you like the science of it? Do you like working with people who are looking to utilize Botox aesthetically?
Yeah. I mean, like before I did the course, I was like, okay, if I'm going to do the course and I'm going to offer this, I'm going to try it on myself first.
Let's go. Let's do it.
Yeah. Like that's the thing. I know I always try to, do it on myself before I, offer it because I want to know what it feels like. I want to see the benefits, right? So I did get some Botox done, and I actually, prior to that, I never thought, wrinkles was an issue.
Sure.
But after getting it done, I'm like, I actually do like the effects. And I like the preventative aspect of it, right? If you get it done, say, starting in your late 30s, it actually prevents a static line from setting in. And for some people, our appearance isn't everything, but sometimes they, can help them feel, good about themselves. And it's not everything, but our appearance is part of it. Some people, they're bothered by, say, like frown lines, for example. They don't want to look like they're frowning. But say, for example, for myself, I'll take myself as an example. I have terrible eyesight unless I'm wearing glasses. So I used to frown a lot. So I have lines in my frown lines. But that makes me look a little bit grouchy sometimes. So with the Botox,
less grouchy.
Prevented less grouchy. So it's just like, little things like that. It's just another tool.
Do you find it easy to bounce back and forth between different therapies? Like how difficult would it be to then, do Prolo and then an hour later do aesthetic Botox? Is it kind of seamless? Is it fine?
It's totally fine. I mean,
I love it.
And it goes back to the fact that I love anatomy.
Sure.
Like I love human anatomy. And like Prolo, it's muscles, it's ligaments, it's joints. Aesthetics, it's muscles that we're aiming for. It's subcutaneous things. It's still anatomy, right? It's working with a needle. It's anatomy. It's just one is addressing pain and dysfunction, and the other one is addressing, optimizing how we feel on the outside.
Yeah, you bring up, like, I think the general theme here is, in terms of career development, it's got to be interesting, right? Like,
Yeah.
I'm super interested in NAD now because I've got such a big chronic fatigue population, and I just feel like I was missing out on one of the things that they needed, and so it's very interesting to me to see them change and evolve after integrating this therapy, and like you're doing it like you're going down so many different paths, and it's inspiring you to keep going and keep helping people in these different ways, and I think that's really cool. I think it'd be really helpful for someone who's just graduating to kind of hear that like you don't have to be restricted into this one thing. And if you do make a decision to go one way, like say you went down the Prolo way and just it wasn't for you, you can just go a different way. It's totally fine. And you can do them all at the same time too.
Yeah, sometimes I think about it. I mean, like if you look at our body, we have a nose, we have a toe. Both of them are useful, just in different ways.
Just in different ways.
But they're all part of the body. We have a nose,
sure.
we have a toe. they're both very important.
So do you see your career kind of staying in the same kind of vein where you have a very holistic approach and do many, many things? Or do you think that you'll eventually niche down?
I'm not sure. And that's a great question. I'm very, I really enjoy doing what I'm doing. And I think enjoying what I'm doing is very important.
Yeah, it's really important. Yeah, when it gets really difficult.
Yeah, it drives me to learn. It drives me to keep going. And honestly, like I said, sometimes it's my patients, and I've learned so much because of them. Like they come in, they ask me about certain things, and I'm like, okay, then I should learn about this, or I should offer this, or I should go get good at this. And that's one of the things that I love about our scope practice and our field.
For sure. I think for the listeners, I mean, they should know that you're also trained in metabolism analysis and fitness programming and nutrition programming, and also you use acupuncture a lot too, like in your practice.
Oh, I love acupuncture. Yeah.
And you still use your RMT certification as well, quite often.
Mm-hmm.
So it's just incredible. It's really exciting. And so what's next for you? What's on the horizon? Like, what do you think is next for you? And what do you think is next for the naturopathic scope? Like, what is coming? I mean, everyone's talking about peptides, and everyone's talking about when certain things come here, people are just going to be so excited about them. What's next for you? And what do you think professionally, where we're going?
Yeah. I'm thinking probably therapeutic Botox, just along the lines of, again, chronic pain or pain management. It can be helpful. And I've had patients ask me for it. So it's kind of, yeah. So actually quite a few times for the past couple of years, actually.
Have they really?
So, yeah. And it's definitely been kind of on my mind to get that certification. And because I offer aesthetic Botox, at least it gets me familiar with all of that. And being able to offer it for pain, I think it's useful, whether it's pain, whether it's migraines, whether it's TMD, whether it's, hyperhidrosis, hypertoned muscles. Yeah.
Completely. And do you think there's going to be anything available for our profession looking ahead? Like, is anything on the horizon for us? Like, if you were to look ahead, like now we've got these other, the one we didn't talk about ozone, but I don't think you do ozone, do you?
I don't do ozone, but I've actually preceptored with someone last year that did ozone, and he actually gave me a little shot of my own ozonated blood, and I think it can be very helpful for certain people.
Wow.
Yeah.
Interesting. And what about PRP as well? Is that something that you're trained in?
So that one, PRP, there's two different ways to offer PRP. That's definitely also on my list. There's the PRP that's more for regenerative injections, and then there's PRP for aesthetic reasons, right?
Okay.
So for the regenerative injections, I could do that because I already have the certification for that, but I currently do not offer the PRP for aesthetic reasons.
Right. Okay, very cool. So much opportunity. It's just incredible. And like, without knowing you, I would still be in my lane, not thinking about any of these other things.
No, you you have so much knowledge and expertise.
Knowledge is there for certain things, but it's the certifications. It's moving beyond, what you are trained in school to do, which I think is a lot, by the way. I think that naturopaths, this is not a path that everyone has to take at all. It's just kind of a fun path. And kind of an interesting path, right? To have so many to be learning all the time. I'm in the same realm as you. As just I'm really curious about things, and I just love adding new expertise. So it's really, really fun. Well, listen. Thank you so much for joining me today, Ming Mei. I'm interested. Where could people find out more about you if they're looking to work with you, or, for example, learn from you?
Yeah, I mean, you always say this, but I don't feel like I have any expertise per se. I'm just trying my best to learn. But if you want to connect, I'm at Noble Naturopathic. I have Broadway location on Thursdays and alternating Saturdays. And then I'm at their Evolve Strength downtown location on Fridays. And then I also practice in North Van 1 day a week, as well as in Cole Harbor 1 day a week.
Awesome. Sweet.
Yeah.
Sweet.
Yeah.
Well, thanks so much for coming on the show. It was really, really nice to talk to you, and I look forward to learning more from you as we continue to work together.
Thank you so much for having me. I definitely feel lucky to be able to come on here.
Awesome. Very cool. Nice chatting with you. Have a great day.
Me too.
Bye.
Bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Duizer and at Get VitaminLab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.